My public health intervention is based on type 2 diabetes, specifically prevention and management in rural Indigenous populations. The background to this problem is in Australia we have a really high incidence of type 2 diabetes. 1 in 17 Australian adults were known to have diabetes, which was found in a report by the Australian Institute of Health and Welfare, with Indigenous Australians 4 times more likely to have type 2 diabetes. So there was another report found that 1 in 8 Indigenous Australians had diabetes, which was done in 2018. It's also been found that Aboriginal and Torres Strait Islander Australians have a 1.8 higher chance of dying from diabetes in remote and rural communities. So this is where it gets more specific in the population. The main causes that I've addressed in this intervention, considering that it's already such a high incidence, are the genetic predisposition and vulnerability that Indigenous Australians have for this condition. So because they have only been exposed to the type of diet that is a risk factor for type 2 diabetes for a short amount of time, say 100 years. This means that they are less able to cope with the physical implications that a diet that's high in sugar and fat and processed foods has. So another intervention is early diagnosis and screening for prevention. It's been found that there's quite a young age of onset for Indigenous Australians in rural populations because of the diet and lifestyle that they have, but also because there's a higher prevalence of gestational diabetes for women, Indigenous women, which means that then the fetus is exposed epigenetically to a higher chance of diabetes in the womb, and then also means that the mothers, Indigenous women, are more likely to go on to develop type 2 diabetes after they've had gestational diabetes. So early screening would really prevent this and help to get people back on track at a younger age or at the onset of diabetes and gestational diabetes. So one of the huge factors in diabetes type 2 is the dietary environment and social determinants that exacerbate the risk factor. So obesity is known to be a huge risk factor, as well as smoking in diabetes. And so these two things, if they can be addressed, then that means there's a low risk. So something else that has been found in numerous studies is that the best way to treat a lifestyle disease such as diabetes is to empower the people who have the disease to use self-care and to know what it is that is helping and not helping them in that. And so that's another intervention to use. So traditionally, naturopathic interventions for diabetes focus on glycemic control, which can be done through diet and lifestyle or through herbs, and improving insulin sensitivity, weight loss, to remove some of the risk factors, and also just lifestyle and diet. So the overall goal of my intervention is to reduce the incidence of type 2 diabetes using early prevention, lifestyle and dietary modification. The first objective that I have is primary prevention. So that means the strategies used to do this would be to educate the communities and healthcare practitioners in the areas to the early risk factors, and so they can help to screen younger kids, and also screening for gestational diabetes, which would help in a twofold way. One is to help the mothers who have gestational diabetes so they don't go on to develop type 2, and the other way is to help the children who are born with mothers that have gestational diabetes, because that just gives them an extra risk of exposure to diabetes later on. And all new diagnosed patients, a third strategy, all newly diagnosed patients should be counselled and be given really good meal plans, exercise goals, and closely monitored. So it's all about early intervention, early screening, and then monitoring them once they've been diagnosed really well. So the way in which we could figure out if this is working is by seeing if there's a lessening of new diagnosis in children, and to make sure that women are being screened when they're pregnant to see if there's a reduction in gestational diabetes or there's an uptake in screening for gestational diabetes. The second objective is to educate, empower, and use appropriate engagement strategies. It's been found that in Indigenous communities that it's really helpful to use Indigenous healthcare workers because there's a culturally appropriate way of interacting and explaining things that is understood on a different level to non-Indigenous healthcare practitioners in the same setting. So that is one strategy, is to employ Aboriginal community controlled health services and to use them instead of just mainstream public health. And the second strategy is to encourage all of the people who are diagnosed to register with the National Diabetes Service Scheme so they can take advantage of all the rebates, and also then they're monitored. And so we have a better view of whether this is working or not. That's one way to evaluate it, but also it means that they can get appropriate care. The third strategy would be to create some community gardens with some fresh herbs and vegetables that are traditional Indigenous foods. So that's a way of helping them to engage with something that's culturally important and significant to them, but also will have an effect on their diet because they'll be eating fresh foods and vegetables. There was a study done that was suggested that potentially there are some traditional Indigenous foods that have anti-diabetic properties. Including these would also definitely help because then you've got like another aspect, which is the anti-diabetic effect. And the third objective is to modify the food environment and reduce risk factors. So this is coming from a study that shows that modification of the dietary environment can help to then lower the risk factor. So rather than trying to teach people in a cognitive behavioural therapy mode, it's more about removing the risk factors entirely to make it easier for them to choose the positive things. So the first strategy would be to work with local business owners and reduce the amount of high sugar, fat, and processed foods that are available and replace that with fresh fruits and vegetables. And then their second strategy would be to implement an affordable meal plan service that's subsidised by the government. So then that just removes the choice of less nutritious food. The third is an exercise program geared towards traditional lifestyle, maybe historical bushwalking, things that would be relevant and culturally important to Indigenous Australians to help them get moving, reduce the risk for obesity, and reduce the risk overall that way. So to evaluate that, if we could see the 50% reduction in the diagnosis and progression of type 2 diabetes 12 to 24 months after this was implemented, then we'd know that this is something that's working. Just overall, if we can prevent it at a young age and prevention in gestational diabetes and make sure people are being screened appropriately and that they feel safe and they're engaging with the healthcare services, then there should be an overall reduction.